Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pharmacokinetics of benzodiazepines. So, benzodiazepines are absorbed orally. They have excellent absorption. Then, they are neither induced nor inhibited by microsomal enzymes. So, they have no action on microsomal enzymes like barbiturates, whereas barbiturates will induce the microsomal enzymes and they are also metabolized by microsomal enzyme CYP450. And these benzodiazepines, we have prazipam and clorazepate. Prazipam and clorazepate. These prazipam and clorazepate are the prodrugs among benzodiazepines. And the volume of distribution of benzodiazepines is very high. And the drugs like midazolam and triazolam can undergo redistribution. Redistribution of midazolam and triazolam is more common. So these benzodiazepines are more commonly used sedatives and hypnotics. So among barbiturates and benzodiazepines are most commonly used sedatives and hypnotics.
thank you and thank you for watching.